Okay, so next year they're going to let us loose on patients. Can you believe we have nearly made it? We're going to reach our pot of gold in the form of our registration. Have you decided what kind of nurse you are going to be? How are you going to protect your registration? A key component of protecting your registration is complying with the Code of Conduct for Nurses. Standards, codes and guidelines are put in place by the Nursing and Midwifery Board of Australia to establish the requirements for the professional and to ensure nurses practice safely. The board's key goal is to protect the public. The Code of Conduct clearly outlines what is expected of you as a nurse practicing in Australia, including the legal requirements, professional behaviour, and code expectations. The Code of Conduct is made up of 7 key principles, which nurses are expected, using their professional judgment, to apply to practice, with the goal of achieving the best possible outcomes for their patients. We are now going to provide some practical demonstrations of how nurses can apply the codes of practice. For each demonstration, consider whether the nurse is abiding by the code or putting their registration at risk.
Oh, hey, Nora. Yes? Could you help me get some essay for my patient, please?
Not a problem.
Yeah, sure. Nora, I'm really stressed out today. My patients are demanding and difficult.
Oh, I was taking care of them the other day. With so much work, I can totally feel your pain.
Yeah. Well, I have 2 patients need morphine, one 5 milligrams and one 10 milligrams. Shall we just sign the book now for both of them and rather than come back again?
Yeah, why not, sister?
Yeah, sure.
Just do it.
Okay. Hi, Mrs. Bate. I have your medication for you today.
Yeah, it's your morphine. For your pain.
Yeah. So you want to take it right now? Yeah.
This is your water.
So it's your medication. Okay. Thank you. Oh, please sign the book.
Sure.
Okay. Thank you. Great. Thank you.
There are many things in this scenario. There's not really much the nurses actually do right. Firstly, they don't perform a legal check. They take out 2 patients' medications at the same time. They don't perform a 3rd check. And last but definitely not least, it all results in them giving the wrong medication to the wrong patient. This is definitely not a good example of abiding by the Code of Conduct. The nurses place the safety of the patient at jeopardy.
Hi Betty, how are you feeling today?
Hi, not very well. I feel very uncomfortable because I haven't been able to pass urine.
Yes, it must be very unpleasant for you. Well, I'm here to discuss the option of inserting an indwelling catheter into your bladder to help you pass urine and make you more comfortable.
Oh, okay. That sounds a bit scary. What is that?
It's a plastic tube that we insert into your bladder and it drains all the urine out. It's for a temporary time period. During the procedure, it will be slightly uncomfortable, but it will ease your current discomfort. Also, I need to let you know about the risks associated with this procedure, such as infection, bladder spasm, and cramps.
At this point, I just feel so bloated and I just want to empty my bladder, so yeah.
So would you like for us to insert the catheter?
Yes, please.
Okay, thank you. I'll grab the equipment and come back to you soon.
This scenario was a positive example of abiding by the Code of Conduct. It showed an example of informed consent. The nurse involved the patient in the decision-making process and illustrated patient-centred care. The patient was informed of all her options and the risks and benefits of the indwelling catheter were explained. There was no pressure applied to the patient and she was given the opportunity to ask any questions and raise any concerns that she may have about the procedure. The nurse clearly asked if she had the patient's consent before performing the procedure.
Hey, good morning. Did you see Mrs. Robert in bed too?
No?
She's the one with all the bruises all over her. And she told me it's been happening for years. Poor thing. And some of them look really, really nasty.
Really?
Yes.
Seriously? Oh my god.
She hasn't told anyone about it yet. She
Yeah.
just told me not to tell anyone. She said she trusts me, so don't tell anyone about it.
Yeah, I won't tell, of course. I'm just so glad that she's not my patient. All she does is just press that stupid buzzer,
Yeah, tell me about it.
Yeah.
This scenario demonstrates a breach of privacy and confidentiality. Clearly, the nurse is violating Mrs. Roberts' personal information by sharing it with another nurse in a public setting. This is a breach of the Code of Conduct. Nurses should engage with people as individuals in a culturally safe and respectful way. They need to foster open and honest professional relationships and adhere to their obligations about privacy and confidentiality. Remember, when people share things with you, they're doing it because you're a nurse. Don't break their trust.
Hi Mary, how are you?
Yeah, I'm really good, thank you.
I have a few questions. Actually, you've been in hospital for a few days, and I just wanted to know that the care we are providing meets your individual needs.
Yeah, I'm getting my vegetarian meal as requested, so it's really good. Thank
That's
you.
great. But I was also concerned that we are meeting and respecting your cultural and spiritual needs.
Yeah, well, actually, I do normally go to church on a Sunday, and I will miss it this week, which is a bit unfortunate.
We do have a small chapel in the hospital and a chaplain service I could offer you to Mary.
Yeah, that'd be great.
Okay. May I inquire to your religion?
Catholic.
Catholic.
Not a problem, Mary. It is our aim to meet your holistic care needs, so please let us know if there is anything further to help facilitate your recovery, okay?
The nurse in this scenario acknowledges that only the patient and or their family can determine whether or not the care they are receiving is respectful and culturally safe. The nurse is respectful and does not make assumptions about Mary's spiritual and cultural needs. The nurse is attempting to create a positive and supportive environment for Mary, whereby she feels empowered to speak up regarding her holistic care needs. It is your responsibility as a nurse to ensure you understand and use your professional judgment to provide care that abides by the Code of Conduct. If your practice as a nurse varies from that described in the Code of Conduct, your registration will be at risk. Australian nurses must provide safe, kind and compassionate nursing care.